I'm excited this year to see some of the updated data that will be presented at ESMO 2024, and just wanted to give you some of the highlights that I'm looking forward to seeing and getting into the nitty-gritty details of what's being presented. From a clinical trial standpoint, I'll start off, there's, I think, a lot of exciting trials, of course, but three that I'll want to highlight. The first is that we've been asking, since the data has been presented from CONTACT-03, if the use of continued immunotherapy after a patient with metastatic kidney cancer is something we should be doing. A lot of practitioners in the community we recognize have been doing this, and we know from CONTACT-03, where we looked at a switch with atezolizumab, looking at a PD-L1 inhibitor, and perhaps going from PD-1 to a PD-L1, would that be helpful? CONTACT-03 was negative trial, showed that the addition of atezolizumab to cabozantinib did not provide benefit, and in fact, perhaps we saw some increased toxicity compared to using cabozantinib alone. But then that's left a lot of questions, I still think, regarding the story of PD-L1 agent versus a PD-1 agent. And so at ESMO 2024, Dr. Tony Choueiri is going to present the TiNivo-2 study. TiNivo-2 is going to help answer this question by using nivolumab, so a PD-1 checkpoint inhibitor, in combination with tivozanib or Fotivda that's approved in the refractory setting for metastatic kidney cancer. Most commonly, we use this for patients who are in third and fourth line refractory disease. It's a randomized clinical trial held, worldwide, and the comparator arm is tivozanib alone. And so I think this will help us answer whether or not PD-1 inhibition after frontline refractory checkpoint inhibition is helpful. We know, in fact, from a press release that's been issued by AVEO that the trial did not meet its primary endpoint. And so look forward to kind of seeing those details that come out in Dr. Choueiri's presentation, and how this really then translates into practice, which I hope will help inform for patients and sequencing of treatment after that frontline immunotherapy. Then I think there's going to be two other presentations that will have some additional questions answered. So we've seen over the last year several presentations about HIF inhibition. We know from the randomized phase 3 looking at belzutifan versus everolimus, and recent approval by FDA in December of 2023, that there was an improvement in PFS. And Dr. Brian Rennie will be presenting the final data update on this at ESMO 2024. So look forward to seeing if we get the overall survival data, and to see what those updated numbers look like to help inform us how HIF inhibition is working in such a refractory, delayed patient population. These are patients who've had prior IO and prior TKI therapy. And then I think also to add more information to the benefit of HIF inhibition, we're going to see Dr. Eric Yonash present a novel HIF inhibitor, NKT2152. So this is a compound that is being presented in clinical trial format from a phase 1/2 study, looking similarly in patients who have been previously treated, so patients with refractory disease, but targeting HIF inhibition in a different way, novel compound. And so look forward to seeing what that data looks like, what their PFS objective response rate is, and kind of will help, I think, add in the totality of the data for the benefit of HIF inhibition in metastatic kidney cancer. Then I also want to mention another study that I'm excited to see come about is one where we lack data. This is for patients who have non-clear cell kidney cancer, where it's hard. We recognize in these rare subtypes to perform large randomized phase 3 clinical trials. And so we often go based off of data from the aforementioned clinical trials that I just went over. So there's been a huge effort, and just, kudos to the whole group for this clinical trial called SUNNIFORECAST. It's a randomized phase 2 looking at both inclusion of patients with papillary and non-papillary. So the trial is stratified based on subtype histology here, as well as IMDC criteria. And then patients are randomized to Ipi-Nivo versus the standard of care. And the primary endpoint of this study is overall survival at 12 months. So really looking forward to seeing this. The trial in total was meant to accrue a total of 306 patients. I think the initial analysis presented maybe was going to happen after the first 200. So look forward to seeing what those numbers look like. Meant to accrue over a multitude of international sites. And so, again, kudos to those investigators for doing the hard trial in a rare patient population. And then I think some of the additional data to be presented especially in oral format, is seeing a phase 2 trial coming out of Italy about fecal microbiota transplantation versus placebo in combination with pembrolizumab. So looking forward to seeing what, as this microbiota story continues to develop, what that clinical trial shows us. And lastly, I think a personal passion, of course, is biomarker development, trying to understand predictive and prognostic biomarkers. And anytime I see David Braun's name on the schedule, I'm always excited to see what he's going to present. So it looks like we might be learning a little bit more about biomarkers from the CheckMate 9ER trial. The title of his talk is Novel Serum Glycoproteomic Biomarkers to Predict Response to Nivo-Cabo. So looking forward to seeing, what he has to teach us about, and hopefully continue to move the field forward.